The South Shore's Morning News continues. Rob Hackala with the morning team. The doctor's in the house now every Thursday at this time. Dr. John Hayes stops by the studio. For a better experience at the doctor's office, try Dr. John Hayes' new highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com, drjohnhayesjr.com. Dr. John Hayes is here in the studio. Good morning, Doctor.
Hey, Rob. Good morning.
Good morning. Good to see you.
Same here.
The topic this week, the chronic pain, neuropathy, and blood sugar connection. All right, let's get into this.
Yeah, so, it's a huge topic, Rob, and we've touched upon this in the prior months regarding prediabetes, metabolic syndrome, it's sometimes called, diabetes in particular, its influence on health overall. But some of the things that I want to talk about today are things that people are not necessarily aware of. And that really is that so often in primary care we see a lot of patients come in that just don't feel well, aches and pains, frequent complaints and so on. And then ultimately early neuropathy, which is becoming more and more of a problem, which unfortunately a whole lot of it is lifestyle dependent. It's no secret that, as a society, we haven't done a good job keeping up with our nutrition over the last 40, 50 years, especially too many processed foods, sodas, etc., that have really gotten people into a whole host of trouble. But the point I really want to emphasize today is that so much of what helps us manage our blood sugar is correctable. Now, some's not, and some forms of neuropathy are very, very difficult to deal with, chemotherapy neuropathy, genetic neuropathies, and so on. But even still, having a better handle on our metabolism and how we process and manage nutrients like sugar goes a long way towards helping us feel the best we possibly can.
Okay, so elevated blood sugar is one of the most devastating consequences of metabolic syndrome and diabetes.
Right. So we all know about diabetes where blood sugars tend to be elevated and you walk into the doctor's office or go to the doctor's office, you get tested and you've got a high blood sugar, can be sometimes over 200-300 or more in the emergency room. Or you can have a routine blood test and you may be told, well, your hemoglobin A1C is just a little high, your blood sugar is just a little high, let's just keep an eye on it.
Yeah.
And often,
they say, it's
right.
Pre-diabetic, and they say, well, you don't really have to do anything now, but we're at least.
That's been the common.
Going to keep an eye on it.
Well, yeah. Unfortunately, though, what a lot of people don't realize, and this is the key takeaway today, is that the earlier we jump on that, the better the long-term prognosis is. And when I first started to get involved in heavily treating neuropathy many, many years ago, I heard a wonderful presentation by a neurologist who simply explained, people that have relatively uncontrolled, even borderline blood sugars over longer periods of time may actually be at more risk for developing things like peripheral neuropathy and some of the other complaints that we commonly see.
Yeah. So it's the A1...
A1C and elevated blood sugars.
That's what I had checked,
exactly.
The A1C. And I was feeling tired, Dr. Hayes, and I was getting sluggish in the afternoon. And I thought, well, maybe it's just because I'm getting up early, but I think it's probably related to the blood sugar. I was starting to, just get very, like a cloudy head feeling.
Exactly.
And, and then, feeling sluggish and, just enjoying milkshakes. And,
I get it. Because,
things that we do. Or, maybe it was, a case of pizza or pasta, whatever it was. So, yeah, I mean, I had the same thing. And over the years, doctor, and, the years creep up with you. And the doctor did advise me. He said, we got to keep an eye on this. And then, it's like everything. If you don't have to do anything and they don't tell you anything right away, you just kind of forget about it. You're like, whew, I made it through this one.
Well, yeah. And I actually had the same thing happen to me. I've got family history of diabetes, borderline A1C, about 17 years ago.
Dad and grandfather, God rest their souls, they both had diabetes. So that's what we talked about, family history.
Exactly, which you can't ignore your genetics.
No. So I guess what was a good one? I guess he said around 6 or below, right? Or 5?
Yeah, actually 5.5.
5.5,
yeah,
okay.
Really, the borderline is like 5. Now, between who you read, it's usually considered anything above 5.7 is technically
I'm going to tell you,
doctor,
at the end of the summer, my number was a 9.
Well, there you go.
It was awful.
Yeah, and it can be. Now, it's also so important to just make sure that the entire panel of work is done, because I recently had a patient come back with hemoglobin A1C just on the edge, but when you look at their fasting blood sugars, they're clearly diabetic and may have been for quite some time.
Yeah.
So it's important to look at that, see if there's sugar, glucose in the urine, and so on, and a bunch of other tests to do. But
I guess I got some work to do. But I do want to say, Doctor, to you that since August till now, I got it to a 5.6.
Congratulations. That's awesome.
So the thing
awesome.
is, I paid attention, and I made the changes that I had to do.
There you go. And it does make a big difference.
Yeah.
One of the things that I really want to just emphasize today, because we'll talk about this much more as the month goes on, is that one of the reasons that people feel lousy with metabolic syndrome or prediabetes is what's called glycosylation of proteins, which basically means when our blood sugars are higher than they should be, some of the glucose or sugar molecules can actually attach to proteins in our body, creating some feelings of stiffness, achiness, soreness. Sometimes patients are told they have fibromyalgia, and they may, or they may have an underlying arthritic condition, and this can sometimes just compound it. It's something just a lot of people don't realize.
Okay.
So it's very, very, very important to pay attention to this whole concept of prediabetes and metabolic syndrome.
Attaching to the protein structures.
Yep.
Okay. Well, I guess this makes sense, and, we are what we're made up of, and if we have these components, and sometimes it's just too much for the body to deal with. I had too much. The doctor said your body's trying to get rid of this sugar.
Right.
It doesn't want it, and I guess sugar's in almost everything, isn't it? Well, we have a problem in this country with sugar.
We do.
Yeah.
And it's processed foods in general.
Yeah.
And, processed foods and sodas are probably the two biggest, hands down.
Yeah. But I guess you're right about, so I guess when you have maybe aches or pains, you got to maybe kind of look close. What is this? Is there an underlying cause?
Well, exactly. You've got to get worked up. I've got patients in my office I see with this all the time, and we have to screen them, make sure they don't have lupus, rheumatoid arthritis, or worse, autoimmune disease. All those things need to be checked. This is why you need to have a very, very thorough workup, and not feel like you're getting blown off, or we'll check it next time, that type of thing.
Yeah.
So
that's what you do. Dr. John Hayes in Marshfield. And, of course, by the way, anything we talk about, he's got a lot of great blogs and information at drjohnhayesjr.com, drjohnhayesjr.com. Also very active on social media. I always get little videos that come into my feed with Dr. John Hayes. So it's great because, you're just trying to share your knowledge and help people and tell them that, you can talk to you.
Right, exactly. Make things down, break things down into simple pieces, and anybody can reach out anytime.
Yeah, that's what's great. He's in Marshfield. He's a local guy. Be happy to talk to you. You can text him at his office at 781-659-7989, 781-659-7989 for Dr. John Hayes. And anything else you want to make sure we get out this week, Doctor?
Well, this is a topic we're going to explore all month long because it's so important. But any questions, like Rob just said, please just reach out. We really appreciate it. Texting is the quickest, but you can also email us, contact us on social media, whatever your preference is. All
right. drjohnhayesjr.com is the website. You'll find his info there on how to text him and how to get in through his email as well, if that's easy for you. drjohnhayesjr.com. And Dr. John Hayes is in the studio. He's with us every Thursday at this time on WATD. Thank you, Doctor.
Thank you, Rob.